So my name is Dr. Trevy Ramos, and I am a general surgeon and a hepatobiliary surgeon. So liver surgery, gallbladder surgery, pancreas surgery, bile duct surgery. Those are the things that I do with ETSU surgery. I became a doctor because as a very young person, you are trying to decide what you want to do with your life, and very simply, I wanted to help people as a young person. I think that very much evolved into a lot of different things as I moved through medicine. It became a lot more than I just want to help. It became I want to be able to communicate better. I want to be able to do the right thing for people, even if it's going to take a long time, even if it's going to take a lot of effort. I want to make people feel like they're cared for. So I originally chose general surgery in general because of the exposure that we got to in the OR, and then later on because of relationships that you establish with patients. The relationship that a surgeon has with the patient is a lot different than, in my view, than other specialties have. Once you make a connection, you have that connection forever. So the relationship that I saw my attendings when I was in training establishing with people was a lifelong relationship, and they would come see them even if maybe they didn't need to. And that's okay because they had a different kind of trust with that person, and that was special. The most rewarding part of my job is probably after the surgery is over and being able to see the patient back in clinic or see the patient in the hospital and being able to tell them we got the tumor out, or it was completely resected and maybe the prognosis isn't great, but we're going to work through this together, and it's a project that we're going to have. So after it's over and helping them get through the rest of their care is probably my favorite part. So what are my overarching goals for my patients? I originally became interested in hepatobiliary surgery, mouthful of surgery, because of the need in this particular region. So my overarching goals for my patients are being able to bring them better care. I think general surgery, it used to be as it states, a general specialty, and as medicine has kind of evolved, so has surgery for the liver and the pancreas and the gallbladder and the bile ducts, etc. And so I wanted to be able to be better at that and provide that specialty care to this region. My ideal day at work would be waking up super early, rounding on my patients in the hospital, going to clinic, finishing up in clinic, and scheduling my patients for surgery the following day, being able to have successful surgeries the following day, and going home and having time with my family. The training that has prepared me for providing better patient care now has been particularly my fellowship. I think general surgery residency for sure did a very good job of preparing me for surgical training, but my fellowship training exposed me to a lot of very sick people, a lot of pathology, and put me shoulder to shoulder with the people that trained me, which are people that I think are leaders in the field and I idolize, and I feel that they showed me a whole spectrum of how to care for patients, the different disease processes, and I feel that fellowship training was what best prepared me for this specialty. I'm an avid bike rider. I love to road bike. I like to gravel bike, and I'm starting to sort of get into mountain biking a little. We love to kayak, we love to hike, we love the outdoors. And we love all the people that we meet in the outdoors. So I meet some of the most interesting people in East Tennessee and in North Carolina, or the surrounding areas too. It's just people flock here because it's beautiful. There's seasons and the people are great, and the outdoors are amazing. Hi, my name is Dr. Trevy Ramos. Thank you for spending a bit of time with me, and thank you for choosing ETSU Health.